This question is about the difference between the two-point eyelift technique compared to the existing techniques. To begin with, it's the instrument. I use a 25 gauge 50mm cannula for the two-point eyelift technique. However, it is a technique that takes into consideration most of the signs as well as symptoms commonly associated with the aging process. Let's go into a little bit more detail about some of the relevant anatomical structures in the infraorbital region which are relevant to the injection of hyaluronic acid filler. If you draw an imaginary line down the pupil, medially the deformity is called teardrop deformity. Laterally, the groove that you see in the infraorbital region is called the palpebral malar groove. The extension of teardrop deformity diagonally down through the middle part of the cheek past the mid-pupillary line is called the mid-cheek groove. Historically, back about 9, 10, 11 years ago, the techniques that existed at the time focused only on rejuvenating the teardrop. And the two-point eyelift, the primary difference between that technique as well as existing techniques is such that it takes into consideration those deformities and rejuvenates not only the teardrop deformity, but as well as the palpebral malar groove. And you can also take into consideration the existence of the mid-cheek groove and rejuvenate that with the same entry point. But most importantly, as mentioned in the previous question, the fundamental difference between the two-point eyelift compared to existing techniques is that it helps injectors establish exactly the correct depth of placement of the filler. So I would like to think that if you are able to master this particular technique, it will certainly give you a lot of confidence in rejuvenating not only the teardrop, but the entire infraorbital region.